Support for the Living Wisdom podcast is provided by InTouch Pharmaceuticals, a long-term care pharmacy committed to meeting the specialized pharmaceutical needs of their clients. Visit intouchpharma.com. Welcome back to our Living Wisdom series. I'm Christine alongside Deb, and we are really diving deeper into dementia. Of course, dementia, what we're learning is really an umbrella term for symptoms that we see with people. But the question is, what causes dementia?
Right.
And of course, people hear Alzheimer's. That's
Right.
what everybody talks about.
Right.
But we're spending some time in this series talking a lot about other brain diseases that cause dementia. And one of those is Lewy body. And I have never, again, added to the list, I've never heard of Lewy body before.
Okay.
What is it?
Okay. So Lewy body dementia is a dementia that happens because there's this abnormal deposit of protein bodies in the brain tissue that affect the brain's ability to pass messages through chemicals we call neurotransmitters and the way brain cells receive those kinds of chemicals. In the case of Lewy body dementia, there's a very specific area of the brain, very specific kind of chemical that gets impacted by these brain protein deposits, if you will. The reason it's called Lewy body dementia is that the neurologist who discovered these unusual protein deposits was Dr. Lewy.
Okay.
And so Lewy bodies are named after him as the person that discovered these abnormal deposits. The thing many people don't know is how common Lewy body dementia is. It is the second most common type of dementia that happens for people who do not have a dementia that is medically connected to aging processes. So in our last session, we talked about vascular dementia, which is the second most common overall, but it is a type of dementia that's connected to the normal aging diseases that occur. Lewy body is not impacted by normal aging. So in terms of dementias that occur that are not connected to normal aging medical kinds of things, it would be the second most common.
Okay, so age group that this affects, if it doesn't have to do with aging, can it be any age group?
So typically it's after the age of 50 is where we see the highest incidence of this, but there have been individuals who have then been diagnosed or had the onset of symptoms at a younger age. Typically, it's after the age of 50, and typical characteristic lifespan is somewhere around 5 to 8 years.
And there's no cure for this?
There is no cure. Again, it's about symptom management, but no real treatment that can reverse it.
Okay, as we dive into this, let's talk about what causes it. Obviously, you said kind of an abnormal protein.
So what happens is this abnormal protein is a very, what we would call, for lack of a better term, a sticky kind of protein. And what happens is these proteins clump together. And as they clump together, they start to kill off brain cells wherever this deposit happens. And that clumping of those proteins is what causes the brain cells to either become very dysfunctional in the way they operate or just simply die.
Interesting. And so you said what's interesting about Lewy body is it's very different from Alzheimer's in the sense that it doesn't have a memory component to this?
So specifically, let's talk about where in the brain these deposits happen. And so there's a specific area of our brain that is producing a chemical called dopamine, and the brain cells around that area of our brain are dopamine receptors. That's important to know because that area of the brain is the area of a brain that helps us control movement of our bodies, okay, both voluntary and involuntary movement.
Right.
This is the same area of the brain that is impacted with Parkinson's. So for people who have Lewy body type dementia, they also get and are blessed with the physical component that is very similar to what we see with Parkinsonian kinds of illnesses.
Okay.
So, having a lot of muscle rigidity and stiffness, having problems with balance, being prone to falls, having gait changes where they walk with a very shuffling kind of gait. All those things are very characteristic of what we see with people with this kind of dementia because of that specific area of the brain that's being impacted by these clumping proteins, if you will. So people with this kind of dementia move very slowly. They have lots of hand tremors. It's not unusual for these people to have what we call apraxia, or this kind of process where their bodies just freeze up and stop moving midstream.
Oh, wow.
And so those are all some of the very typical characteristics we see with Parkinson's. But when somebody has specifically been diagnosed with Lewy body dementia, they get this physical Parkinsonian-like component as well as the other characteristics that come with dementia process.
Yeah, so what are some of those additional, so on top of all that, you got more?
One of the things that you mentioned earlier was that this kind of dementia has the ability and characteristic where sometimes these individuals' memories are very intact.
Yeah.
We don't see that characteristic short-term memory lapse or inability that we would see in other kinds of dementia. This kind of dementia, individuals tend to be sporadically confused. So they're not confused and disoriented all the time. They don't have memory loss of short-term memory typically that we would see with something like Alzheimer's disease. They have some different kinds of brain dementia symptomology, if you will, that's very specific to this kind of dementia. One of those is hallucinations, visual hallucinations. This type of dementia has a very specific kind of hallucination that is just a very terrifying, threatening kind of nature to their hallucinations. I remember a particular individual that we cared for who had this kind of dementia, and I actually recall him breaking out a window to try to get out of the building because what he saw happening was he had a very vivid, realistic visual hallucination that there was a man holding a knife to his wife's throat outside the building. That's what he saw. So, busting out the window wasn't about an aggressive behavior. It was about trying to react to what he saw that felt very vividly real, and he was attempting to get to his wife to do what he thought was save her life.
Wow.
So these individuals can have some really vivid, very realistic hallucinations. But the other piece that's kind of interesting about this, there are also times when these individuals will know that what they're seeing is not real. This same individual, it was not unusual for, once we were able to treat some of his symptoms, get some stability back in his cognitive processes and what he was experiencing. I remember sitting with him out in our atrium area, and it wasn't unusual during an interaction with the two of us for him to say, well, Deb, so I'm guessing that gentleman I see sitting in that chair over there with the machine gun isn't really real.
Wow.
And I'd be able to say, you're right, it's not real. I said, we will always protect you. We will not let anybody come into this space that might bring you or anyone harm. So it's just a really interesting nature of this kind of dementia, where it kind of has that fluctuation, and there are moments of total lucidity and memory for these individuals where they can identify and realize that what they're experiencing is not what everybody else is experiencing.
Wow.
Yeah.
There's some sleep disturbances that come with this as well.
Yes. So one of the things that's a primary disturbance that comes with this kind of dementia is, for most of us, as we experience that REM sleep cycle, if you will, that's when we are dreaming actively. And our bodies, if everything's functioning typically the way it should, our bodies have this safety mechanism that disconnects us physically from what we're dreaming, that protects us from, if I'm having a nightmare where I'm being chased down the road by some big scary monster, my body doesn't jump up out of bed and take off running because that's what I'm dreaming. For people with Lewy body dementia, that safety mechanism goes away. And so it's very, very common for people with this kind of dementia to act out whatever they dream about.
Wow.
So when they have nightmares or they're experiencing traumatic kinds of frightening things, they will physically react to that. So nighttime safety becomes a big concern for caregivers. It's not unusual that these people will be moving around, thrashing in their bed at night to jump up and, physically move during their dream experience.
I was going to say, is there any medication that can help with the hallucinations or even these dreams? But you were saying they kind of react differently to medication too.
Correct. So by the nature of this kind of dementia, their brains and bodies react very differently to medications that we would commonly use to treat some of this. So sleep medications, psychoactive medications to help with hallucinations, and some of the night terrors that people would experience, some of the things they experience with just overwhelming anxiety because of the nature of some of the things they experience. Their bodies react to that very, very differently and can actually cause symptoms to be worse in some cases, and in some cases hasten death.
Wow.
Just by the nature of the kind of dementia they have and the way their bodies react to those medications.
Well, yeah, how can you not be going through anxiety, depression,
Right.
all those things when you
Right.
when you experience
Right.
that? You were also saying falls, dizziness, vertigo, fainting, so all that on top of all this.
Correct. So again, that goes back to the nature of that area of the brain that's impacted. They have one of the characteristics of this kind of dementia physically on people is that they have these really severe fluctuations in things that our central nervous system typically regulates. So body temperature, they have a really increased sensitivity to hot or cold. Stabilization of their blood pressure, it fluctuates, specifically with position changes. So it's not unusual for somebody's blood pressure to be normal while they're sitting, but as soon as they stand up, the bottom falls out.
Wow.
Which predisposes them to dizziness and falling and those kinds of things. So there's a lot of changes in sensitivity. Another thing that's characteristic for this kind of dementia is that, we know people with other kinds of dementia will ultimately develop some incontinence and inability to control urine and, those kinds of things. But one of the things that's characteristic of this is that incontinence happens very early in this process.
Wow.
So it's not one of those things that we don't see till it's more advanced. It usually is one of the initial characteristics that we see with this kind of dementia. And, the fact that, when we talked earlier about that Parkinsonian kinds of symptomology that we see, another thing characteristic of these individuals is that they develop this very stooped forward kind of posturing.
Okay.
So when they walk looking down, leaning over. So that predisposes them to a higher risk of falling.
It's interesting because when you think about Alzheimer's, right? Yes, there's that memory loss and forgetting how to be able to do things, but ultimately, it becomes, at least it appears, more painful for the caregiver than it does for the individual. Whereas this, it feels like there's just kind of pain
Right.
through and through.
Yeah, and the other thing that's really difficult for this is that these people who experience this kind of dementia, for the most part, are very aware of what's happening and what's changing. And so it becomes a very anxiety kind of experience where people are just waiting for bad things to happen or to experience bad things as they go through this process. The other thing that's really interesting for caregivers and other people in their life is that this individual's cognition fluctuates greatly throughout the course of a day or from day to day. So it can be a situation where, you know, in this moment in time, you and I are having this conversation and you are right on the money. You're not confused. You have no signs of dementia. And the next day, you can be completely different, have a lot of confusion, not remember things, be very traumatized, if you will, in what your cognitive abilities look like. That leads people to believe that these individuals are choosing to act that way, that it's intentional. You were okay yesterday, how come you're not today?
Wow.
So it appears to people that they're doing this by choice, and it is not. It is the way the nature of the disease is.
Wow, it's cruel.
Yeah,
It sounds
it
very
is.
cruel.
It is, and so commonly these people get accused of faking,
Yeah.
you know, being confused or faking like they need more help than they do. And that's absolutely not true. It's
They've been
just
through enough.
Right.
They can use
That's exactly
the help.
right.
So let's talk about diagnosis and treatment. How is this diagnosed?
So typically, it's back to that same kind of scenario that we had with Alzheimer's disease. The only 100% sure way to do it is with a brain autopsy and identifying those clumping proteins called Lewy bodies inside brain tissue. In the person's lifetime prior to death, basically they're going through that same kind of rule out process that we talked about with Alzheimer's disease or vascular dementia. They just go through a whole series and batteries of tests and trying to look at history. They will look for that Parkinsonian type characteristic. This kind of dementia has clinicians use what's called the 1 year rule to kind of differentiate between, is this just normal Parkinson's or is this Lewy body dementia? Because you can understand how people could be misdiagnosed.
Exactly.
Because the physical aspect of it looks so similar. So what that one rule is about is that if a person develops the cognitive symptoms or the dementia piece of the symptoms at the same time or at least a year before people see the movement, Parkinsonian kinds of things, then it is diagnosed as Lewy body dementia. Okay? If those movement symptoms and you know, the stuff that we see looks like Parkinson's happens more than a year after we see the physical stuff first. So if we're not seeing the dementia until after the physical movement disorders have happened, then typically they're diagnosed with Parkinson's disease that has a dementia as a result of that.
Okay, interesting.
Okay.
And so, of course, that would mean that you'd have to stay on top of seeing your doctor and your health to be able to even track what this is.
Exactly right. And you know, there are some tests that can be done that will show a biomarker from spinal fluid. There are tests that can be done to look for this abnormal, what they call a misfold protein. But both of those tests are extremely invasive. They're uncomfortable. They're costly. Insurances typically don't pay for them.
Of course.
And it really doesn't change the diagnosis or outcome for the person doing that. So typically those are not used in terms of a process of diagnosis. So treatment for these individuals really focus on safety and the management of symptoms. So trying to manage those terrifying hallucinations, helping people process through emotionally and psychologically what they're experiencing as part of this kind of dementia process. It's helping people understand what it is they're experiencing and how that feels, how that looks. This is a kind of dementia that can be very traumatic for family members and caregivers. All dementia is,
Right,
but each different one has a different challenge, a different level of what people are coping with. And this just tends to be a kind of dementia where there's just a lot different kinds of things. And, you know, when it comes to this kind of dementia, these people are capable of a lot more from a cognitive, interactive, independent engagement, normalized kind of living than people typically with Alzheimer's disease are.
Yeah.
So it's really important that we help people stay active, stay making good decisions, stay being able to do things for themselves and continue to do the things that they're interested in and that they like and that bring joy and pleasure to their life, because they have a lot more ability to do that than typically somebody with Alzheimer's disease is. And so sometimes people are not treated that way. Once people hear that dementia word, people think, oh yeah, this person's not going to be able to do things anymore, because they look at what happens to people with Alzheimer's disease. And this is a much different kind of component and progression than what we see with typical Alzheimer's disease.
If they're not really responding well to medications, is there a way to make them feel more comfortable? Is that where the caregiver steps in? So if they are having those night terrors, they're there to like console them, and can they understand that, or kind of what do you do?
Yeah. So one of the things we tell caregivers about this kind of dementia is the most important effective thing you can do is to just be present.
Okay.
These people live with so much fear. These people live with so much challenge when it comes to understanding what's happening to me, having the loving physical presence of someone to just support you through this. I still remember having those conversations with the gentleman I referred to earlier. Sometimes it was just sitting next to him and holding his hand and saying, I know this is really frightening, but you're going to get through this. We're going to keep you safe. We're going to be here. And that's really most of what they need, is just having somebody sitting with them and saying, no, you're not crazy. No, you're not losing your mind. We are going to get you through this. We're here for you. We're going to keep you safe. It's, giving people and then utilizing and seizing those opportunities when that person is lucid, when they are normal, if you will, when they can continue to live their life in a normal way, whatever that looks like, seizing the opportunity for that to happen, because those are the things that are most therapeutic for this individual.
It sounds like this one too would be so beneficial for caregivers to have support groups.
Absolutely. And this is a very different kind of dementia than typically what people think about with either Alzheimer's or vascular kinds of dementia. And so I also want people to know there are very specific agencies out there. There is a Lewy Body Dementia Association. There are, there's lots of good resources from the Parkinson's Foundation. There's lots of resources out there available to you. Just get on people's websites, web pages if people have questions or confusions about, who do I contact? How do I please reach out to us. We will be more than happy to have people find their way to resources that can help, because this is a very specific kind of journey with this Lewy body kind of dementia, and it is different than other kinds of dementia. And so family caregivers need support, but sometimes they need a different kind of support than typically somebody with Alzheimer's disease loved one might need.
Support for the Living Wisdom podcast is provided by InTouch Pharmaceuticals, a long-term care pharmacy committed to meeting the specialized pharmaceutical needs of their clients. Visit intouchpharma.com.